Good afternoon and welcome to today's IAC webinar, Sonographer Ergonomics, Avoiding Pain and Injury. My name is Kelly Baer and I am the Creative Design Manager with Marketing Communications at IAC. Before we begin, I'd like to take a moment to review a few technical matters and let you know how you can participate in today's session. We would like today's webinar to be interactive, so we encourage you to submit questions. To do so, use the Questions tab located on the left side of your screen. Please submit your questions anytime during the webinar, as we will be monitoring questions throughout the presentation, and we'll try to answer as many of them as possible during the Q&A period. Also on the left side of your screen is the Resources tab. Click on this tab for links to today's handout, a PDF copy of these PowerPoint slides. Select the file name to download the handout. Lastly, in the lower left of the player, please note the Request Support button. If you experience any technical problems during the course of this webinar, you may click this button. A technical expert will be there to assist you with any issues you may have. For those who like to take notes during the presentation, look to the right of the slides and click the Notes tab. There you will see a white text box where you can take notes on today's webinar. These notes will be emailed to you automatically at the end of the session. To be eligible for the ASE CEU credit, you must be registered, logged into this webinar, then complete the survey. The survey will open automatically at the conclusion of the live session and be available from the IAC Pro Libraries website for 3 business days. If you are viewing this webinar in a group, please be sure you are also individually registered and logged into this webinar on another computer or device so that we have record of your attendance today. Today's presentation is being recorded and will be posted at a later time for on-demand viewing. And now I would like to introduce our guest presenter, Dr. Merri Bremer. Merri is the Quality Improvement Education Coordinator at the Mayo Clinic Echocardiography Lab in Rochester, Minnesota, and holds an academic appointment as Assistant Professor of Medicine at the Mayo Clinic College of Medicine. Dr. Bremer is board certified as a registered nurse and holds the RDCS credential from RDCS and also the ACS credential from CCI. In 2015, she completed a doctoral degree in educational leadership. She serves on the IAC Board of Directors as well as the IAC ECHO Board of Directors representing SDMS and is a fellow of the ASE. During the past 15 years, Merri has lectured nationally on the topic of sonographer ergonomics and quality assurance. And with that said, I will now turn this webinar over to today's speaker, Dr. Merri Bremer. Merri?
Thank you, Kelly. Just for housekeeping details, I have no disclosures. I thought of different ways to sort of frame this webinar today, and what I finally kept coming up with is trying to come up with a reason for why I want to give you this message. So my introduction is, my name is Merri, I am a sonographer, and I am broken. And the point of this webinar is to prevent any of you from becoming broken sonographers, or if you are, trying to give you some ideas for helping you move through a work-related injury. Today, the objectives are really to define the term ergonomics. I want to discuss some of the risk factors for work-related musculoskeletal disorders, and then also discuss suggestions and recommendations for modifying risk factors in sonography. The other thing that we're going to be doing is actually working on a couple stretching exercises that you can use as a sonographer to try and mitigate your risk factors. First, though, I would like to ask a couple questions. And the first question is, with which hand do you scan? Are you a right-handed scanner? Are you a left-handed scanner? Or do you scan with both? And we'll give just a minute for you to put your answers in. While those are coming in, I can tell you I scan with both hands, although I probably have the stupidest left hand on the face of the earth, but it can be done. Okay, so very even. We have 39% left, 43% right, and about 16% scan with both. Keep that in mind. We'll be talking about ambidextrous scanning later on. The second question I have you been injured while scanning? Yes, no, or I'm not sure. And part of what this question is getting at is whether you as a sonographer are really aware of what your body feels as you are going through your scans every day, because this is a physically demanding profession. And I think that the earlier that we get used to feeling how we feel during the day and really taking note of that, the better off you are in terms of risk management. So 47% have been injured, 37% are saying no, and about 14% aren't sure. Okay, let's move forward. So when we define ergonomics, you can find different definitions here and there. The one I like really is from the Board of Certification of Professional Ergonomists. It's a body of knowledge about human abilities, limitations, and human characteristics that are relevant to design. And this really is applied to the design of tools, machines, systems, tasks, jobs, and environments. And really what it's intended to do is to help workers be safe, whatever that work is. Another way to think about it that is a little less academic is that the goal of ergonomics is to design the job to fit the worker, not to make the worker fit the job. And I think the thing that we need to remember is that the worker, the job, and the environment are intertwined, and you can't just pull one of those things out, fix it, and then say that you've got good ergonomics. So really, during this webinar, we'll be looking at multiple factors in each of these areas. Now, we say it's to make the job fit the worker. Well, Homer Simpson here has quite the job fitting the worker. I do have to say that I've never seen an echo lab or any kind of ultrasound lab that has quite this kind of a setup, but I do like the foot bath. The key is that when you have a mismatch between an individual's capabilities, and this is typically physical, although I think emotional well-being is also important, and the environmental demands, injuries will occur. And it's part of our job to make sure that we reduce the risk for injury. I'll be talking later about a consensus conference that the Society of Diagnostic Medical Sonography pulled together in 2003 that was really focusing on work-related musculoskeletal disorders. And there they defined these disorders as a range of conditions caused by repetitive, forceful, or awkward movements that cause injury to muscles, tendons, and ligaments. Kind of sounds like what we do every day. Now, this term can be used to group many different diagnoses, and it affects many different body parts. It can be acute, or it could be chronic. I'm in the latter category now, I'm chronic. But it's often related to innovation and technology changes. And I don't know if you've noticed, but for those of you who have been in this career for a while, there's more and more and more that we can do, which makes our scans longer and longer and longer, and that tends to put us more at risk. But at the bottom of it all is that there's a mismatch between the physical requirements and the physical capacity or capability of the individual. And we really can't afford to be handcuffed. I know we have a very large lab. We're getting close to 100 sonographers here at Mayo Clinic Rochester. And periodically we have times where we've got sonographers out on leave or they're on restrictions, and it really does cause a problem in terms of providing good patient care. It also affects the individuals, and I'll be talking more about that later. In terms of negative effects, well, we can start with increased monetary costs. If you have an injury, you need to get medical care, which is going to cost your employer or you. If you're injured, you're not as happy with your job, so employee dissatisfaction rises. If you're on restrictions, there's lost productivity. And if you are injured and still working, are you really going to do the best job you can if you hurt while you're doing that job? And this is just a vicious cycle that I see over and over again. So work-related musculoskeletal disorders are just not a good thing. We can kind of loosely group these disorders into three types. things affecting muscles, those affecting tendons, or nerves. You can get more technical, and you can see on this slide, this is just a quick rundown of some of the identified disorders. The one right here, de Quervain's disease, is my particular bugaboo. I'll tell you the story. When I had been a sonographer probably 3 or 4 years, I was doing a stress echo, and the patient came off the treadmill. I got my apical images, and then I was going to the peristernal window, and I dropped the transducer because I couldn't feel it. And I sought care at that point. They diagnosed de Quervain's disease, and I realized that somewhere along the line I had decided that the tighter I gripped that transducer, the better pictures I would get. Well, it doesn't work that way. And the reality is that now I have chronic tendinitis on my thumb, and it's hard for me to grip anything. So use that as a story to strike fear into your heart, if nothing else. My goal during this talk is really to get you thinking about the risks. So talking about risk factors, really it boils down to this: excessive force or exertion, which I certainly was doing with my gripping, awkward or sustained postures, think about the bedsides that we sometimes have to do, and frequency or repetition. If you do it often enough, it is a risk factor. And down at the bottom of this slide, this is actually from some Mayo Clinic ergonomic materials. If you have force and or an awkward posture and or repetition, and this occurs over a long time, you have increased risk for musculoskeletal disorders. Now we're going to take just a moment to do a relaxation exercise. Ordinarily when I give this talk, I can actually see people doing this, so I'm going to have to use my imagination. But just go with the flow and take the time to do this exercise. You'll find you can do it between patients, you can do it in the middle of an exam, you can do it when you're sitting at your computer. So sit straight, and I want you just to bring your shoulders up towards your ears, as you can see in the diagram on your left. Bring it up and hold it there for about 5 to 10 seconds. It shouldn't hurt, but you should feel a stretch. And then go ahead and let it go down again. This is an easy one that you could fit in anywhere in your day. And what it does is it relaxes those shoulder muscles for you. I suppose I should have prefaced that by saying if you've been injured, be careful doing this so I don't get in trouble taking you through exercises that you shouldn't be doing. Now, the literature regarding injury in sonographers goes back a couple decades, and a lot of it has been published in the Journal of Diagnostic Medical Sonography. This was actually one article that was published in 2001 that talked about injury rates in sonographers. It was survey research, and between the two big surveys that have been done, between 80 and 90% of sonographers are reporting scanning and pain. The thing that was interesting to me about this 2001 article is that it did identify anatomic sites of discomfort in sonographers. And if you look, I've highlighted the ones that are most common. So shoulders, necks, yeah, I'm guilty of both of those, wrists, low to middle back, and then hands and fingers. The thing that I found really interesting is that even eyes can be affected. And if you think about how we look at monitors, that's absolutely understandable. So let's talk about the symptoms of musculoskeletal disorders, because they're sneaky sometimes. After my injury, I thought about it and I thought, I've been feeling a little bit of soreness there and sometimes some tingling, but I just ignored it because I assumed that I was invincible, just like most of us do. So it can range from a pain or dull ache to a loss of sensation, tingling, burning sensations, tenderness or swelling, or just muscle weakness and fatigue. The thing that's interesting with me now is if I scan more than about 10 minutes with my right hand, I start shaking, and I hate it when that gets captured in the clips. Muscle spasms, loss of movement, all of those things can be symptoms of musculoskeletal disorders. In terms of progression of the symptoms, and this is why it's so sneaky. Early stage, really, you may have a little bit of aching and tiredness, but it's usually only during work, and it really doesn't bother your work performance. You just kind of notice it, put it aside, and move on. When you get to the intermediate stage, Well, you go home and you're aching and you're tired. And you find that you have a reduced capacity for repetitive work. What I started finding, I'm a piano player, and I found that I could not do those octave stretches, especially with my right hand anymore. And then in late stage, it's aching, fatigue, and weakness, which persist at rest. And sometimes it's bad enough that it's hard to sleep. It's hard to do your usual work, outside work. And we don't want you to get to that point. The cumulative effect is that with continued exposure to risk factors and a longer time frame, you go from fatigue to discomfort to pain to injury and then disability. And because we are such tough healthcare workers, we typically do not report it until we've actually had the injury. So if you bring nothing else out of this webinar, keep in mind that these are the places, especially in the fatigue and discomfort, where you can fix the problem before it occurs. You can prevent the injury, so you really need to be paying attention. Early diagnosis and effective management prevents the progression of these. There's really quite a wide range of treatment options. I had a cortisone shot in my thumb, which was pretty darn interesting, but I also had therapy and a bunch of other things that we did. The problem is if you have the injury, you do successfully treat it, and then that recurs, you go downhill from there. So again, I'm going to say it again and again, early diagnosis and get treated early. Don't let the injury happen, and if it does happen, make sure that you're behaving in terms of what you've been instructed to do. So let's talk about the consensus conference just a little bit. This, you can find actually the document for this on the SDMS website. And I find it really helpful when I'm trying to structure an approach to ergonomics for sonographers. So this was in May 2003, and it was chaired by Joan Baker, who is a pioneer in sonographer ergonomics. She has her own company and provides many assisting devices as well as good education regarding keeping healthy as a sonographer. There were also representatives from industry, education organizations like ASE and SDMS, and administrative representation as well. And the goal really was to develop risk-reducing standards that serve to address these musculoskeletal disorders. Now, they sort of divided things into three areas, and I find it very useful to structure things this way. You can look at equipment and what you can do to equipment to reduce risk. You can look at administrative controls and look at what you can do to reduce risk there, and then also professional controls. And that's where each of us comes in, because what we do in monitoring our habits is probably the thing we have the most control over. So let's look at equipment control measures first. And these include things like ultrasound systems, control panels, the monitors, the transducers, tables, chairs, and other accessories. So for those of you who have been around a long time, we used to have these huge mechanical transducers that would vibrate as we were scanning, and the ultrasound systems were just enormous. Things have changed. The equipment companies really have listened to the ergonomic needs of sonographers, and you'll find that most things now are adjustable. And really, adjustability, if that's a word, is key. So adjustable chairs and tables. Forearm and elbow support. For any of you lefties out there, you really should be supporting that forearm and elbow. Adjusting the keyboard and monitor. Having a remote monitor. We actually have our room set up so that we not only have the monitor on the machine, but we can also see across the bed what's the images that we're obtaining. A footrest. That's a handy thing to have. It really helps with the lower back. Transducers and cables are becoming more lightweight, and if they're not, they do have assistive devices where you can actually sort of wrap a device around your wrist and take the weight off your hand of the transducer cable. And it's also important to really carefully choose equipment for mobile services. The thing with this is that if the equipment is adjustable, it's really important for us to know how to adjust it, because it doesn't do any good if you're not using it. So again, for those of you who have been around for a while, talking about mobile services, I used to do outreach, and this is the machine that I used to push through 6 inches of snow in the parking lots. And luckily, it's not that way anymore. If you think about the different systems that are out there, we even have laptop-sized devices now. And so we are able to, I think, be a lot safer, especially in terms of bedsides and outreach sites than ever before. Okay, it's time for another stretch. Sit up straight or stand. And I want you to just slowly lower your head to your chest until you feel a gentle stretch. If it's hurting, don't do it or back off. You just want to feel a gentle stretch there. So bring your chin down toward your chest and then bring it back up. And then tilt your head towards your left shoulder and hold it there for about 5 seconds. You should feel the stretch on the right side. Bring it back to the midline and then to the right. Hold that for a couple seconds and then straighten up again. The other part of this is to turn your face to the left. Hold it there for about 5 seconds. Come back to the midline and then turn your face to the right. This one I'll do in the middle of an exam because it's easy to do and it helps loosen things up. All right, let's move on to the administrative control measures. And I think this is something that I'll say we experience challenges with because really this has a lot to do with employers, with workload and scheduling, promoting safety, and exam areas. So if we think about what the employer can do, if you're in a larger organization that is really safety conscious and has good ergonomic programs, if you are experiencing a situation where you are at risk for injury, you should be able to ask for an evaluation either of your scanning or the place in which you work. Really the goal is to have a safe work environment, not only in terms of, say, equipment safety, but then also in terms of ergonomic safety. Preventive education is really important, and you are all doing that by attending today, but it's important also that it's on the radar, so to speak, of your employer. So then we come to the reasonable schedule and adequate breaks, and this is always a challenge, quite honestly. What one person thinks is reasonable, the bean counters may not think is reasonable. But it's important to look at the cost-benefit ratio because if you have a broken sonographer who's going to be out for 6 weeks, that's a lot more expensive than keeping it at 7 studies a day as opposed to 10. The other thing is really employers should be on board in terms of encouraging exercise programs for the sonographers. And you'll hear a little bit more about that from me later on. In terms of the workload, again, I know it's a challenge. We run into it here all the time. You do need to allow time to adjust the equipment. So if you are an Ambidextrous scanner and you want to scan left-handed in the morning and right-handed in the afternoon, then take the time to adjust the equipment in the afternoon. Take the time to help less mobile patients. It's not going to do you or the patient any good if you try to move them along faster than they can move. And do allow time for breaks and lunch. The other thing that really I think is important, especially for sonographers who are new to the field, we get out of school, we start working, we are money hungry, and the overtime that you see with call is really attractive. I see it every year with our new grads. The problem is if you have excessive overtime, whether it's voluntary or not, you run a greater risk for injury because of all the things we've already talked about. So be very, very careful about overtime. In terms of promoting safety, it's very important for employers and sonographers to promote stretching exercises, which is what we've been doing today, and we'll do a few more. It's important to consider scanning with both hands. We actually are getting to a point where we've got about probably 40% left-handed scanners and about 60% right-handed scanners here. And I'm trying to get as many people ambidextrously trained as possible. In terms of the patients, be aware of the patients that pose the most risk of injury. Our patients are getting bigger. They're getting sicker. We see patients who can barely move. If you are 5 feet tall and 80 pounds, do not try to move somebody who is wheelchair bound and weighs 128 kilos, not by yourself. Get help. The other thing is the risk of bedside exams. And sometimes there's not a lot we can do about that. I think we end up in awkward positions. I'm even thinking, say, the cath lab. But you have to take care of yourself on these bedside echo exams. So even if there are nursing staff or nursing assistants or whoever who appear to be irritated that you're asking for help, do it anyway. They'll live, and this way you don't get hurt. Position the patient close to the edge of the bed. Don't lean over. If you can adjust that bed height to your height, do. Really, most people do bedside standing up that I'm aware of. If that doesn't work for you, make sure you've got your chair and you get that bed height down to where the chair is. Also, really, again, if you are an ambidextrous scanner, it doesn't matter how much equipment is in that ICU room, you're going to be able to scan from either side of the bed and take better care of yourself. So there, I'm off that soapbox for now. In terms of the exam area, it's really important to have a dedicated exam area. Again, I remember in my early days of outreach, we had one site that had one of those short little, physician exam beds, and we put the patients on that, and the room was tiny, 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 and it just barely worked then. It would not work now. So a dedicated exam area, wide doorway access, especially important with larger patients who are wheelchair bound, suitable flooring, adequate ventilation and temperature control, and adjustable room lighting is a real bonus. Dimmer controls, or if you've got windows, that they're adequately shaded so that you don't have as much eye strain. This is just an example of one of our exam rooms, and you can see we do have nice wide doors, and we've got the room set up so the sink is here on the left. I deliberately kept this in here because this is a safety issue. If you look at all the cords that are hanging down here that make you or the patient at risk for falling, those should be hooked up here on the hooks. Get them out of the way. The other thing is that you tend to run over the cords, and our equipment guy hates it when he has to replace an electrical cord. So again, making sure that the exam area is set up for your needs. Okay, time for a shoulder stretch. I love this one. I want you to lift your left arm to the level of your chest, just like it is in the picture, and then place your right hand on your left elbow and just gently pull your left arm across your chest. Take it as far as you can go without hurting. You should be feeling the stretch on that left shoulder. Hold it for 5 to 10 seconds, and then let it go. And shake out that arm. Then do that with your right arm. So bring your right arm across at the level of your chest. Gently pull it across and hold it there for 5 to 10 seconds. The key with all these stretching exercises is that you do it slowly and you hold it for 5 to 10 seconds. Okay. So let's continue on to the professional control measures. I think this is the thing that we are really able to control the most. We'll be talking about best practices to reduce risk. Physical fitness is a big part of that. Education and training, and then some scanning tips that we'll go over. And again, you're doing the education part just by being here today, so thank you. In terms of best practices, it may seem like just common sense, but because we care about our patients and we want to get really, really good exams, we tend to forget about ourselves. So you need to make sure that you minimize the sustained bending, twisting, and pressure. Again, practicing ambidextrous scanning is a very good thing. Avoid those awkward postures where you're bent over backwards trying to get images in the cath lab. Make sure that you adjust the equipment. It is adjustable equipment for a reason. And relax your muscles periodically. We'll talk about that a little bit. There are many times during the course of a regular exam where you can give your muscles just a little bit of a break. The other thing that's really important is maintaining physical fitness. This really, I consider sonography a sport. And if I am not physically fit, then my body is not going to have the capacity to meet the demands. So it's really, really important that you do that. Stretching exercises are critical. being aware of and maintaining good body mechanics. Taking the time to really, really make it right. And then, as I've said before, and I'm sure I will say again, you want to avoid the initial injury. So I included this out of some of our ergonomics materials. We do spend time at computers. If you're really lucky, you've got sit-stand workstations, or you've got a situation where you can stand. The main point with this is not that we spend all day at a computer, as some do, but if you've got a monitor, make sure it's about an arm's length away and that the top of the monitor is at or just below eye level, because that has implications for your neck, your shoulders, and your eyes. You want your upper arms as close to the body as possible. And that's where, when you get to be a right-handed scanner and you're scanning cardiac, that can actually be a problem because we're often stretched way out over these patients. The wrists should be straight with the hands at or below the elbow, if at all possible. If you are using a chair, make sure it's a chair that's got good spinal support. Try and get your thighs parallel to the floor, and your feet should be flat on the floor or on a footrest. And you'll find most of the machines nowadays do have a footrest. I use it all the time. If you prefer to stand while you're scanning, a lot of the same things are in play. But the key thing is that your head, neck, torso, and legs are in line. So you want to make sure that you aren't twisted, that you have got that bed set up so that you're as straight on to the patient as possible, and that you've got the monitor and the machine adjusted appropriately. So you don't want to look like this when you're scanning, I guess is my point. This is a right-handed scanner. His arms look pretty long, and the patient doesn't look really big, so I don't think he's having to stretch too much. But boy, is he leaned over, and he's got that keyboard way, way over to the left, while the monitor is way, way over to the right. And you can see that that would really cause some bending and twisting and just awkward posture. So I've included in this PDF some postures to minimize, and I'm not going to spend a lot of time on all of them, but a couple I do want to call out. Our necks are important. We do a lot of looking down, up, twisting sideways, and that's part of the reason why I included that neck stretching exercises. In terms of the back, flexed, lateral flexion, twisting, all those things end up being bad. Now, I'm saying you should minimize these postures. It doesn't mean you eliminate them, but you don't hold them for a long time, and you try not to have to do them. In terms of the arm or the elbow, I think, or the wrists or the hands, really, if you do a lot of flexion of your wrist and hand, that's where you start to get some of that irritation of the tendons in particular. So you really need to be careful when you are doing that. In terms of your legs and your feet, again, if you're going to be doing footwork, if you've got, if you are doing the work with a machine and you've got to do your clips with the foot pedal instead, make sure that it's in a good position. If it's shoulder work that you need to do, and I'm thinking, again, cath labs and even just doing regular resting transthoracic echoes, make sure that you don't have really long extension of your arm or unsupported. In terms of wrists and hands, different grips. So I'm looking at this one over here and thinking that's what I used to do with a transducer. I gripped it really, really tightly. And now if I'm feeling that is too tight, that my tendonitis is not cooperating, I'll often hold the transducer actually between my first finger and my middle finger, just for a little bit of a break. It does take a while to get used to, and I've got big hands, so I can do that. You may not be able to do that if you have smaller hands. But look for different grips to use so that you're not always in the same grip. In terms of forces to minimize, and this is really, I think, key. A static force is a force which is held for more than 20 seconds. And this is where I got in trouble, because I pushed hard, I gripped hard, and I kept it there for a long time. But I want you to do me a favor. Just take your thumb and your first finger, and I want you to push them really hard against each other for about 10 seconds, and just look and see what happens to those two fingers. The tips of your fingers should be turning white. So what's happening there, and then go ahead and let go. Don't hold that for too long. What happens there is that you are actually making those fingers ischemic by gripping so tightly. And what happens with ischemia and muscles and tendons is that that sort of roughs up the muscles. It makes them inflamed. Then you get fibrosis. Then you get injury because it's more prone to tear. So stay away from the static forces. Make sure that you're not holding it for more than 20 seconds if you can at all avoid it. This includes bending forwards and backwards, holding things in your hands, again, the arms outstretched or raised above your shoulders, or raising your shoulders for long periods of time. And that's something that I hear about in the cath lab because you're in those awkward positions and you're trying to scan under sterile drapes and all that sort of thing. But then also standing in one place for long periods of time. One thing that I will try to do if I'm scanning standing up is that I may do parasternal standing, I may do apical sitting. And just to have that variety during the course of an exam is really quite helpful. Pushing, pulling, lifting, carrying. Again, the machines are smaller nowadays and they tend to push better, but keep that in mind. And then again, the gripping forces. Okay, I really like this stretch. So you do need to be seated for this. Sit in a chair, tuck your chin towards your chest. Again, you don't want to feel pain, just the stretch. And then slowly bend forward toward the floor until you feel a mild stretch in your lower back. Do it slowly. Hold it for about 5 or 10 seconds, and then release and come back up slowly. I've been doing this one for the past 3 days because I spent Saturday picking up brush in our woods and burning it. And so, yeah, this has been my friend the last few days. In terms of overall fitness, it's really important that we get regular exercise, some sort of conditioning program, even things like taking the stairs. And you really need to focus on targeting problem areas. I recently started doing yoga with an eye toward helping my back and neck, and it really has been helpful. Although be careful when you get started. There are yoga apps that you can get for your smartphone, and I did the basic yoga, and the next day couldn't move. So make sure you start slowly. It's also important to have a healthy diet and get adequate rest. And I know I have an 18-year-old. I think I'm getting less rest now that she's out at night than I was when she was a baby. But it's important to try and get that rest. Be reasonable in terms of your exercise program. So start slowly, gradually increase intensity and duration. And really what you're trying to do is to tone and build strength. So you don't have to be an endurance athlete. I'm certainly not. But I try to use the elliptical, I take walks, I do the yoga, I try to do the stretching exercises, and all of those things will help me here in my job. The key is to be consistent. So don't go hog wild, hurt yourself, and then decide never to exercise again. Start it slow, be consistent, and gradually strengthen. One thing I found that was helpful was finding buddies. So walking breaks, stair breaks, exercise companions. My daughter and I now do our elliptical in front of each other so that we can cheer each other on, or join community programs. The key is really to make it fun. So I don't like running, but I like walking, so that's what I do. Playing golf, you're kind of cheating if you take the cart, but I understand. Tennis, basketball, anything like that. In terms of the education, really we need to educate ourselves and educate our employers. So have them watch this webinar, because education really is the bridge to prevention of work-related musculoskeletal disorders. We and our employers need to become aware. Typical content for an education session is kinds of injuries, principles of exercise, core exercise programs, and proper scanning techniques. And if you have an institution that's got ergonomic resources, this is just an example of what we have here. We can actually take a look. We can click if we're feeling on the body, click on the area where we're experiencing symptoms, and then it can come up with possible causes and solutions. And I find this a really helpful tool. Let's talk about scanning tips for a little bit, because this is, again, is one of the things that you can do the most about. Micro or mini breaks. Really what this is if I am scanning, I'm scanning parasternal, and I move to apical, I take a second, put the transducer in the other hand, and shake out the hand that I've been scanning with because it gets the blood flowing again and it relaxes the muscles. Vary your position. Do one patient standing, one patient sitting. Minimize the reaching and twisting, all the things that we've been talking about. Support and position your hand. So if I'm scanning and I've got a really skinny patient and I'm on the ribs, I put the base of my hand on their chest and then hold the transducer very lightly on the rib. Avoid excessive pressure. This is probably where contrast comes in because, again, our patients are getting bigger. Maintain good posture. Ambidextrous scanning. Are you tired of that one yet? Become multi-skilled. If you can do vascular and cardiac or do transthoracic and stress or TEE, it allows you to do different things and you work on different sets of muscles. Pay attention to what feels good and hurts. And again, make sure that you are getting early evaluation and treatment. This I included in the materials for this webinar. I found it very, very helpful. It was published in 1998. Print a copy of this off and put it right next to your machine because you need to ask yourself these questions. Is a patient too close to me or conversely is a patient too far away? Have I adjusted things? How's my posture? How's my wrist and neck? Are they straight? How's the monitor and keyboard? If I'm standing, am I sort of slouched to the side or am I standing with my weight equal on both feet? Am I supporting my limbs properly through the entire examination? I think that's really important because if you aren't using bolsters, if you're scanning left-handed, then you end up sort of being at an awkward angle. And then the micro breaks and the mini breaks are just consciously releasing the tension for the micro break. So between peristernal long axis and short axis, just relax a second. Mini break, as I mentioned, removing the probe from the scanning hand and such. And then being aware of symptoms. So this checklist is actually on one of the slides. I would encourage you to print this slide and put it up. Here's the challenge, though. And this always drives me crazy. So the most effective job task modification occurs because of engineering controls, and it's probably the thing we have the least control over. Administrative controls, workload, scheduling, those sorts of things is sort of in the middle. And then the work practices, the thing that we have the most control over is the least effective in terms of job task modification. So what that comes back to is us focusing on what we can control. We have this little zone of control, which is what we do and how we approach what we do. Then there's a zone of influence, and that may be, to some extent, workload and scheduling. So if you're being scheduled for 12 studies a day at 30 minutes apiece, and you're an IAC accredited lab, and it should be 45 minutes apiece, you need to take that accreditation standard to your employer and say, hey, wait a minute, we're not supposed to be doing this, because that can decrease the amount of scanning that you're doing in a day. And then there's stuff that's just out of bounds. You may not be able to control what equipment you purchase. That may be more of an area of influence. So really, I would encourage you to focus on the things you absolutely can control and those you can influence. One more neck and shoulder stretch. I like this one too. I want you to turn your head to the left side. Let's go left first. And then tuck your chin towards your chest. And you're going to find that that's stretching different things than we've stretched before. Hold it for 5 to 10 seconds. Shake it out. Kind of move your neck around a little bit. And then let's go the other way. So turn your head to the other side and then put that chin down. Oh, golly, that feels good. That's also one you can do in the middle of an exam. Let's talk a little bit about right versus left-handed scanning. What's interesting to me is that the injury rate is no different if you're a left-handed scanner versus right-handed scanning, but the injuries themselves are different. So left-handed scanners tend to get wrist and elbow problems, and it makes sense thinking about how you're positioned, whereas the right-handed scanners tend to get shoulders and necks. I just wanted to highlight this article on ambidextrous scanning that was published in 2009. And really what they were trying to do was look at patient size, sonographer experience level, and hand preference both to see if the image quality differed, because, the argument always is, well, if you're scanning left-handed, your pictures are worse, or conversely, if you're scanning right-handed, your pictures are worse. And that may not be the case, so they went ahead and looked at it. They also measured grip force, which I thought was interesting. The key findings were that the bigger the patient, the greater the grip force. Makes sense. The bigger the patient, the greater the shoulder abduction. And if you think about it, yep, that makes sense too. So we're stretching out more. But there was no significant difference between hand use and the amount of grip force. So it didn't matter if you were a right or a left-handed scanner. The bigger the patient, the greater the grip force. And most importantly, there was no difference in image quality between right versus left-handed scanners. So the findings, they concluded, were that both inexperienced and experienced sonographers could benefit from being ambidextrous. One thing that I've noticed, people have talked about this way of doing right-handed scanning that you see in this image, and I could never quite get my head around it until I found this picture. But essentially, this is a right-handed scanner who has got the patient sort of flipped around from the traditional right-handed scanning. And that way he can be set up nicely ergonomically. I think we have to be careful, though, because this arm could be unsupported. So if you're going to be doing it this way, make sure you've got a chair with arms, and make sure that you're not really flexing your wrist tremendously. But it's certainly an option for those of us with stupid left hands. Okay, tricep stretch. I like this one too. Put your left hand back between your shoulder blades, and then use your right hand to push your left elbow up and back. You're going to feel that in the triceps. And let it go. And then do the same thing with your right arm. Put your right hand between your shoulder blades, or as close as you can get, and then use your other hand to push the elbow up and back. And then shake it out. Okay, so the last thing that I have is just about a 5-minute little video. I found this online. It was made by some Australian sonographers. And what it does is kind of encapsulate everything that we've been talking about here. And after this, then we'll go ahead and go to the questions. So enjoy. And you get some nice little music with it as well. And this is called the ultrasound trap, scanning in pain. So you see that we have the boss who's on the phone with the sonographer, who evidently has been injured and is at home. And there's frustration on both sides. So the boss says, "What do I do?" Well, in Australia, the numbers are consistent. 93% of sonographers by survey research are in pain or discomfort while scanning. And it is saddening. That's why I feel so strongly about this. sonographer mentor, emphasizing back being straight, arms supported, neutral wrist. And as I've been saying, we can reduce these injuries, but we need to make sure that we use the equipment the way it's supposed to be, and we use our bodies the way they're supposed to be used. And as they say, how else can a sonographer avoid the ultrasound trap? I just wanted to have a couple take-home points. What works for one person may not work for others. I find that I have more trouble being ergonomically correct when I'm scanning left-handed because my arms are quite long, whereas right-handed scanning, if I behave myself, is actually fairly comfortable, except for my wrist. Prevention is the key. It's really important that you intervene early. Focus on what you can control, because that's really the way that you will be able to escape the ultrasound trap. We don't want you scanning in pain. And for those of you who are in this profession, you want to be able to do it for years. And I thank you for your attention. A couple of resources here, Sound Ergonomics publications, and then the SDMS website. And I think at this point we'll open it up for questions.
Okay, thank you. At this time, we'll begin the Q&A session. From IAC Echo, I'd like to introduce Bev Gorman, Senior Director of Accreditation, and Ann Groves, our clinical specialist, who will be assisting with questions today. Bev, would you like to start us off?
Sure. I have a question from Dan, who would like for you to share an image of the scan room to see, how the monitor is set up.
Our rooms differ depending on the actual room. And here, I think these are rooms actually that we pulled the monitors out of. In general, we tend to have the monitors set up here where you see the oxygen, so that the sonographer is sitting here scanning right-handed, and they can look either at this monitor or they have one in the corner. I think it actually, part of the table that it was on is right over here. The benefit of that actually is that the patients can also then see what's going on, and they find it actually quite entertaining. It's a little bit more difficult to do when we've got a room set up left-handed because we tend to not have a place to put the monitor. But in general, if we've got a monitor in the room, we try to put it over here on the wall so that the sonographer can look either here or here.
I have a question for you, Merri. Dana asked, she's been scanning for 5 years, and she's already experiencing pain daily. Do you have any suggestions as to anything that might work in addition to your stretching exercises?
Go see somebody. I know there's a real reluctance, especially on the part of more junior sonographers, to seek help early on, but if you are already scanning in pain, then you are well down the continuum to injury if you're not already there. So you need to seek help from a healthcare provider, be very honest about your symptoms, and make sure that your employer is tied into this so that they're aware of what's going on. There may be things that you can do in your workplace to help modify the risks that you're experiencing. We actually have one sonographer that is very short and was trained right-handed, and we are going to convert her over entirely to left-handed scanning because she just can't do what she needs to do with right-handed scanning. But I think those are conversations you need to have with your employer and your healthcare provider.
Merri, I have a couple of questions in the same vein. Is there a limit to the number of scans a sonographer should do in an 8-hour workday? And what is the recommended time for a scan? How long should it take?
That's a really good question. I have been looking for literature to come out on that because there's a discussion going on about scan time versus overall appointment time. The one thing that we can point to is the IAC standards, which require a minimum of 45 minutes for each appointment. That does include the time that you're getting the patient into the room and dismissing them and things like that. But in general, there are no hard and fast rules in terms of scan time. What I can offer is that if you are in a facility that tends to have more involved, complicated protocols, you may not be able to control how long you're scanning, say, half hour, 45 minutes. Sometimes it's up to an hour if you're doing research protocols. But it's really important in those sorts of situations to do the best practices things that we've been working about. So you take a mini break or a micro break. You alternate scanning hands on successive patients and those sorts of things. The other thing that you can consider if you do relatively long exams is to acquire all your images and then do your measurements offline afterwards, because that gets you into a different position. And it gives the patient a break too. So unfortunately, there's no good answer to that, but I think you need to just stick to the IAC guidelines in terms of appointments and then work from there.
Okay, William asks or says, Medicare is pushing doctors to do more and more on patients per ultrasound session. What is your advice about the balance between the ergonomics and their efforts to do this?
Yeah, so that's always the push-pull, isn't it? Do more with less. I don't think that's going to go away. If you are being externally required to do more, you can't control that. So we get back to that zone of control. And in those situations, all you can do is try and control what you're doing. So an example would be chemotherapy patients. We see our patients sometimes every 3 to 6 months, depending on how their LV function is doing during their chemotherapy sessions. And what we did to adapt that is they get a full-bore, complete transthoracic echo the first time around, and then it's a truncated protocol if they come back in 3 months or 6 months. So that's a strategy that you might look at with repeat patients. But in terms of any other control, you may not be able to control what you're asked to do, but you can control how you do it. And that's where these best practices come in. I know that's not a very satisfactory answer, but it's really the only one we have.
So, Merri, I have a question from Ben, and he really just wants to know if you could give him some suggestions how to approach his employer, kind of gently, not demanding or anything, but how to implement some of these things in their workplace.
So that's where the education comes in. Ben, I know it's awkward approaching employers. What you might want to do is spend a little bit of time researching the literature or suggesting that they watch this webinar or other webinars that are available out there. It is a huge issue. We see a lot of injury in sonography, and if you can present it in the situation of, I want to work with you to make sure that we're doing what we need to do, but that your sonographers don't get injured so we can continue to provide good patient care, I think you'll get the best reception. Most employers really are open to these sorts of things if you present it in a positive manner. I would like to work together with you to make this the optimal environment for both me and our patients. And be open to the fact that some of the stuff that you think you want to do, they may not be able to do.
Do we have time for one more question?
Sure.
Okay. It was asked, do you think that using weights in the exercise bands would help to prevent injuries?
Yes. So weight training makes those muscles stronger, and it builds your physical capabilities. And the stretchy bands, I didn't include any of those in here, but if you look on the SDMS website, there's a good article on there on stretching exercises for sonographers that use the stretch bands. So what we're talking about are physical therapy bands, actually, and you can use them to improve arm strength. You can use them to work on your back. There are a number of different exercises. So again, if you look at SDMS and Sound Ergonomics websites, there are articles and suggestions for exercises, including those stretchy bands. They're great. I have 3 in my office right now.
Okay, I think this will be the last question, Merri. We're coming up on, we are at 2 o'clock. Do you really find that the ergonomic ultrasound beds are effective in reducing injury?
Yes and no. We were just talking about this the other day. So the ergonomic beds with the dropouts, when I'm scanning right-handed, I very much appreciate the dropout on my side of the bed, and there are actually now little seat extensions that you can put on these beds because, again, our patients are getting bigger. So in that sense, yes, I think it's very, very helpful. Where I run into trouble is there's the dropout on the other side, and if I'm scanning right-handed, I'll often go in a room, say, with a junior sonographer to acquire additional images, and they'll say, do you want the dropout? And my answer is inevitably no, because then I end up leaning over the patient to get all the way underneath the patient. So instead of using the dropout, I tend to bring the patient either completely back on their back or mostly back on their back. I think the dropouts are very useful for the side that you're scanning from. And they're definitely an improvement on the beds that we used to have. They're also very height adjustable, and you can tilt them and such. So, yes.
Okay, thanks again, everyone. And very special thank you to Dr. Merri Bremer for this presentation. Please feel free to contact IAC with any questions that were not answered during the Q&A session. To receive continuing education credit for attending this webinar, please complete the survey. The survey will appear on your screen automatically at the conclusion of this live session and also be available from the IAC Pro Libraries website for 3 business days. In the upper left, you'll click on My Webinars, look for the title of this session, Sonographer Ergonomics, Avoiding Pain and Injury. Beneath this title, you will see the link Take Evaluation. Click this link to complete the survey. Your certificate can then be accessed and printed from the very next screen, and any time thereafter through a new link on the My Webinars page called View Certificate. If you have any questions about the survey, please contact us at webinars@intersocietal.org. Once again, we thank you for joining us today and appreciate your participation.